Today we're talking about Peyronie's disease. It is one of the leading causes of penile shrinking and erectile dysfunction. And worst of all, it destroys penile sexual function by making it bend with erections. It hits most men by surprise, and before they know what is going on, they find themselves on a crazy roller coaster ride between doctors, unable to help you the way you want, if you manage to get an appointment at all, and the internet, where all the experts are who know exactly what to do. Well, if this is you, you may want to listen to this video because I am a doctor and a real expert. In my office, I have specialized in the treatment of conditions like Peyronie's disease and erectile dysfunction. In this video, you will learn how I go about solving your problem. You will be surprised to know that you will have to contribute to treatment success yourself. You will have to contribute substantially, including time, resources, and yes, also money. Can't avoid that part. And finally, I will give you realistic expectations on what to do at each stage of the disease and the expected outcomes. Okay, here's what happens. Triggered by sexual trauma, accidental axial compression of an erect penis, diabetes, advanced age, and many factors we still don't understand, the penis becomes inflamed. More precisely, it becomes chronically inflamed, mostly at a single spot. This spot is located within one of the layers around the cavernous bodies. This layer is called the tunica albuginea. This inflamed area is responsible for all the bad stuff, the bending, the shrinking, the ED. In the initial stages, erections are often painful. This is a warning sign. Erections shouldn't be painful. If you wake up at night because your penis hurts, this could be an early sign of Peyronie's disease. Be aware of that because in some men, things start to happen very quickly after that. They literally go to bed with a straight penis and wake up with a crooked one. That's very frightening for them, no doubt about that. So the question is, can this be fixed? Here comes a bitter reality. Reversing penile curvature is very difficult. For most men, surgery is the only way to correct it. However, there is some hope. A small percentage will regain a straight penis without surgery. In a minute, I will reveal how I go about. But before that, let me make a point that can't be stressed enough. Stopping the disease before excessive curvature happens is the first and foremost treatment strategy. But most men come very late into the disease. I think I have only seen 2 or 3 patients so far who presented at a stage where painful erections still were the only sign of Peyronie's disease. Now, the list of substances one can use as a treatment is endless and can be quite frustrating. I consider myself an expert in this, but also I don't have the silver bullet. The only substances I don't recommend are POTABA and vitamin E in high doses, which I see quite often in clinical practice. If you find my content valuable, please give this video a like and subscribe to UroChannel. My videos are rooted in clinical experience from many years of working as a doctor. Subscribing and liking doesn't cost you anything, but it shows your appreciation for my work. Thank you. POTABA is short for potassium para-aminobenzoate and is no longer recommended. Besides, a dose of POTABA is almost like a meal in itself, so many tablets. And there is some liver toxicity and kidney stress involved as well. Vitamin E is an important vitamin, but there is some evidence that it may increase prostate cancer risk at high doses, and likewise, it may increase the risk of death from all causes. So basically, what I rely on is Tadalafil. You may know this substance by the name Cialis. In theory, it has the potential to reduce and even stop the ongoing inflammation. In practice, it seems to work in most patients, but I have also seen patients progress while on Tadalafil. Together with antioxidants, it builds the foundation of my treatment. Then I combine this with penile traction, platelet-rich plasma, shockwaves, and extracorporeal magnetic transduction therapy. This approach restores penile length And in some cases, it is also effective for penile curvature. It definitely improves erectile function and it gets rid of penile pain. But I only do this when there are no calcifications visible upon ultrasound. Some of these hard nodules gather calcium. In my experience, they are impossible to break with conventional methods. Another problem is curvature. Severe curvature of more than 60 degrees has to be operated on. Or collagenase may be worth a try in these patients. Collagenase is made from bacteria and dissolves these collagenous plaques that you feel as hard nodules. It works quite well according to studies. But even here, I wouldn't propose it for calcified plaques. Collagenase, which is called Xiaflex, is no longer available in Europe. It is only available in the US, but can be imported to Europe. The price of the drug is a problem. For just one shot, it is so high that the costs for a whole treatment over several weeks with PRP, ESWT, and EMTT combined appear like peanuts in comparison. Peyronie's disease has two phases. There is the beginning inflammatory phase. It usually persists for quite a while. Only after 1.5 to 2 years, it slowly shifts into the stable phase. Usually during the stable phase, no further changes happen. I recommend that patients seek help as soon as possible. But in my experience, most seek help late into the inflammatory phase and many only in the stable phase. It is unknown how the therapies I just outlined work within the respective phase. If you are looking for more information about Peyronie's disease and my treatment methods, I have uploaded several videos that describe them in detail. This playlist and this video will reveal more about them. Thanks for watching. Bye-bye.